Through research and treatment, medicine has discovered many reasons for the increase in heart disease, helping to prevent and treat it more effectively. However, in reality, there are still misconceptions about the risk factors for heart disease that many people still believe, as below, updated and answered by the American Heart Association (AHA). Filled right pointer misconception 1. I'm too young to worry about heart disease. Not true, because heart disease is getting younger for a number of reasons, both subjective and objective. The way you live now affects your risk of heart disease later in life. As early as childhood or adolescence, plaque can start to build up in your arteries and eventually lead to blockages. Nearly half of adults in the United States, aged 20 and older, have heart disease, but not all of them are elderly. Even young and middle-aged people can have heart problems, especially now that obesity, type 2 diabetes, and other risk factors are becoming more common at a younger age. Filled right pointer misconception 2. It is rumored that if you have high blood pressure, there will be warning signs. High blood pressure is called the silent killer, so no one knows they have it. You may never experience symptoms, so don't wait for your body to warn you before seeking medical attention. The only way to know if you have high blood pressure is to have your numbers checked with a simple blood pressure test. Early treatment of high blood pressure is important. If left untreated, high blood pressure can lead to heart attack, stroke, kidney damage, and other serious health problems. Filled right pointer misconception 3. I know when I have heart disease because I feel chest pain. Not necessarily. While chest pain or discomfort is common, heart attack symptoms can be subtle. They include shortness of breath, nausea, feeling lightheaded, and pain or discomfort in one or both arms, jaw, neck, or back. Even if you're not sure if it's a heart attack, seek medical attention right away. Filled right pointer misconception 4. Diabetes doesn't harm my heart because I take medication. Treating diabetes can help reduce or delay your risk of developing heart disease. But even if your blood sugar is under control, you are still at increased risk of heart disease and stroke. That's because the risk factors that contribute to diabetes also make you more likely to develop heart disease. These overlapping risk factors include high blood pressure, being overweight or obese, being sedentary, and smoking. Filled right pointer misconception 5. My family has a genetic predisposition to heart disease, so I'm helpless. Although people with a family history of heart disease are at higher risk, you can take steps to reduce your risk. Make a plan to keep your heart healthy by staying active, controlling your cholesterol, eating a healthy diet, controlling your blood pressure, maintaining a healthy weight, controlling your blood sugar, managing stress, getting enough sleep, and quitting smoking. Filled right pointer misconception 6. I don't need to get my cholesterol checked until I'm middle-aged. Testing and measuring risk factors in young adults can help estimate their lifetime risk of cardiovascular disease. Young adults with moderately high LDL, bad cholesterol levels, 160-189 mg per deciliter, may be candidates for cholesterol-lowering medications. After age 20, traditional risk factors should be tested every 4 to 6 years. You can help yourself and your family by eating healthy and exercising regularly. Filled right pointer misconception 7. Heart failure means the heart stops beating. The heart suddenly stops beating during cardiac arrest, not heart failure. In heart failure, the heart is still working, but it doesn't pump blood as well as it should. This can cause shortness of breath, swelling in the feet and ankles, or a persistent cough and wheezing. During cardiac arrest, a person loses consciousness and stops breathing normally. Filled right pointer misconception 8. The pain in my legs must be a sign of aging. I'm sure it has nothing to do with my heart. Pain in your legs or muscles can be a sign of a condition called peripheral artery disease (PAD). PAD results from blockage of the arteries in your legs due to plaque buildup. The risk of heart attack or stroke is increased for people with PAD. Filled right pointing pointer misconception 9. My heart is beating very fast. Am I having a heart attack? Some changes in your heart rate are normal. Your heart rate speeds up when you exercise or get excited and slows down when you sleep. Most of the time, changes in your heart rate are nothing to worry about. But sometimes, they can be a sign of an arrhythmia, an abnormal or irregular heartbeat. Some arrhythmias are harmless, but some can last long enough to affect how well your heart works and require treatment. Filled right pointing pointer misconception 10. I should avoid exercise after having a heart attack. No. Get moving as soon as possible with a plan that works for you. Research shows that heart attack survivors who are physically active and make other heart-healthy changes live longer than those who don't. People with chronic conditions often find moderate activity to be safe and beneficial. The American Heart Association (AHA) recommends at least 150 minutes of moderate-intensity physical activity per week for overall heart health. It's possible to participate in a cardiac rehabilitation program, but first consult your doctor for advice on creating a physical activity plan that's right for your heart health. Cardiovascular disease is a disease that appears silently but leaves many serious consequences and is tending to be younger. The mortality rate due to cardiovascular diseases tends to increase in developing countries. Some things about cardiovascular disease. Heart disease or cardiovascular disease is the leading cause of death in the world today. In the United States, every 36 seconds, one person dies from this disease. On average, 1 in 4 deaths is due to heart disease. Worldwide, heart disease claims the lives of nearly 18 million people each year, accounting for 1/3 of all deaths. According to statistics from the Ministry of Health, in Vietnam, each year about 200,000 people die from cardiovascular disease, accounting for 33% of deaths. Heart disease is a condition related to the health of the heart, caused by weakened blood vessels that make it difficult for the heart to function normally. Cardiovascular diseases are very diverse, such as coronary artery disease, cardiomyopathy, arrhythmia and heart failure. Cardiovascular diseases cause narrowing, hardening and blockage of blood vessels, interrupting or not providing enough oxygen to the brain and other parts of the body, causing organs to stop, destroying each part leading to death. The inherent factors that increase the risk of heart disease that cannot be changed include age. 80% of deaths from heart disease occur in people over 65. Gender. Men have a higher risk of heart attack than women. Race, genetics, obesity, high blood pressure and diabetes. It should also be noted that heart disease can occur at any age, gender, or occupation and is an incurable disease, requiring careful screening, treatment, and monitoring even lifelong, and is costly. 2. What are the different types of cardiovascular diseases? Filled right pointing pointer coronary heart disease or coronary artery disease (CAD) is the most common type of cardiovascular disease. It affects the blood vessels that supply the heart muscle. Angina occurs when the coronary arteries become narrowed and blood flow is reduced or completely blocked. This is often due to a buildup of fatty deposits on the inner lining of the blood vessels. Filled right pointing pointer. The most common cause of CAD is a buildup of fatty deposits in the arteries that supply blood to the heart. This condition is called atherosclerosis and is caused by unhealthy lifestyle habits such as poor diet, lack of physical activity, being overweight or obese, and smoking. Filled right pointing pointer cerebrovascular disease, which affects the blood vessels that supply the brain. A stroke occurs when the blood supply to the brain is blocked or there is bleeding, hemorrhage, from one of the blood vessels in the brain. Arrhythmia or irregular heartbeat, is a problem with the rhythm of the heart. It can be caused by coronary artery disease, congenital heart disease, heart valve disease, diabetes, high blood pressure, smoking, excessive caffeine or alcohol use, drug abuse, or as a side effect of certain medications, including prescription and herbal medications. Filled right pointing pointer congenital heart disease or birth defects develop while a baby is growing in the womb. They can be caused by medical conditions, medications, or genes. Sometimes heart defects occur in adults because the structure of the heart changes with age. Filled right pointing pointer rheumatic heart disease, in which damage to the heart valves and muscles caused by Streptococcus bacteria causes rheumatic fever. Filled right pointing pointer heart infection endocarditis caused by bacteria, viruses, or parasites that invade the heart muscle. Filled right pointing pointer cardiomyopathy, thickening and enlargement of the heart muscle, can occur due to heart damage after a heart attack, due to certain drugs or toxins, over time due to high blood pressure or age, or it can be genetic. Sometimes the cause is unclear. Filled right pointing pointer peripheral vascular disease, which affects the blood vessels that supply blood to the arms and legs. Deep vein thrombosis and pulmonary embolism involve blood clots in the veins of the legs. The clots can break off and travel to the lungs and heart. 3. Some simple ways to prevent cardiovascular disease. Filled right pointing pointer be more active. Lack of physical activity is a major risk factor for coronary heart disease. Lack of exercise causes fat to build up in the blood. Being more active helps lower cholesterol and triglyceride levels. Furthermore, exercise has a positive effect on both blood pressure and blood sugar. Maintain an active lifestyle. Doing regular exercise such as brisk walking, at least 30 minutes a day, or endurance activities 3 or 4 times a week. Filled right pointing pointer eat healthier. To prevent heart disease, stay away from processed foods that are low in nutrients and too sweet, salty or fatty. Eat a Mediterranean diet, with plenty of fruits and vegetables, olive and canola oil eaten raw, and whole grains, while limiting fatty meats. Eat plenty of poultry and fish, and no more than once a week for red meat. Limit egg consumption to 3 or 4 times a week. Remember to stay hydrated, drinking at least 2 liters of water a day, and reduce your salt intake. Filled right pointing pointer pay attention to body weight. Overweight and obesity are the culprits that cause atherosclerosis, plaque buildup on the artery walls and other diseases such as high blood pressure, high blood lipids and diabetes. Being overweight reduces life expectancy. Doctors advise maintaining a reasonable body weight, both beautiful and healthy. You should use the BMI formula to know if you are overweight or obese. BMI is the body mass index calculated by dividing weight, kilogram, by the square of height, meters or centimeters. Normal BMI will fluctuate between 18.5 to 24.9. If it exceeds this threshold, it is considered overweight. Over 30 is considered obese. If you want to lose weight, don't force yourself to cut calories, but increase fiber and protein and reduce foods high in fat and sugar. Be careful with fats and carbohydrates found in cold cuts, sauces, alcohol and processed foods. Start exercising again and, above all, be patient. Aim for steady weight loss of 1 to 2 kg per month rather than crash dieting. Filled right pointing pointer stress relief. Chronic stress not only disrupts the nervous system, but also harms the heart and blood circulation. Practice deep breathing exercises regularly, such as cardio exercises or meditation. Sports and exercise also help reduce stress. You also need to pay attention to the quality of your sleep to regulate your nervous system. Although everyone is different, our bodies need at least 7 hours of sleep a night to function properly. Therefore, reducing stress is a good way to reduce the risk of cardiovascular disease. Filled right pointing pointer quit smoking. According to cardiologists, smokers are 4 times more likely to have a heart attack than non-smokers. Cigarette smoke is not only harmful to the lungs, but also very harmful to the heart and blood vessels. If you quit smoking, your risk of heart attack can be significantly reduced. Thank you, gentlemen and ladies, for taking the time to watch today's video. Maintaining health in older age is an important journey that requires special care and attention. I hope the information and advice I shared will provide you with useful knowledge to maintain your health, live joyfully, and enjoy the golden years of your life. Once again, I sincerely thank you for your attention. Wishing you all good health and happiness. Please subscribe to the channel to motivate me to create more informative videos on health care. See you in the next videos.